Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juleff of the Vein Clinics of Hawaii.
Well, hello and welcome to the Vein Clinics of Hawaii show. I'm Mike Buck, and I'm so excited to be bringing you this program. Vein Clinics of Hawaii has been here on Oahu for the last 4 or so years, but started about 8 years ago, of all places on the Big Island of Hawaii. And that's where Doctor got his first taste of Hawaii. Dr. Randall Juleff is the medical doctor and FACS, which you'll learn about that in just a minute. And he is going to be with us on a weekly basis to not only, answer your questions and talk with you about things that concern, vascular surgery and veins, but a lot of other things. So the clinic is osmosed over the years, and it's supplying a lot of demand. And with that, there's a lot of demand on the good doctors. So we are able to get together a couple times a month and put aside these programs to air on Saturday and Sunday here on KHNR. I'm going to give you websites, I'm going to give you phone numbers, and hopefully a big dose of reality on what Vein Clinics of Hawaii is all about. That, I think, Doc, is the second longest introduction to a guest that I've made in my radio career. Thank you for being a part of our station here at Salem Media, and KHNR. How you doing?
I'm good. Thank you for allowing me to be here. I'm honored.
What's kind of neat to me, Dr. Juleff, is that, what I said in the introduction there is Vein Clinics of Hawaii actually kind of started on the Big Island and came this way. Usually somebody comes to Oahu and they get something going and they say, well, there's a need on the neighbor islands. How do you pick the neighbor island first, the Big Island?
I did it backwards, yeah. I do everything like that. Actually, it was kind of a friend of a friend, and it really, I didn't set out to actually practice on the Big Island, but as it happened and it was kind of evolving, I just went with it. I saw a need for vein care, especially on the Big Island. And we just made it happen, and it's been great. It's been a good office, and it's been our pivot point for the other offices, as you mentioned.
And what we're talking about, I've been down to the Honolulu office. It's fascinating. I mean, the staff there is great. The number of opportunities for different treatment and different conditions is terrific. Of course, you're a time juggler. You're the original guy that has to really mesmerize that. But what I really am interested in, and I know our folks are, sometimes we watch out here in Hawaii that we've got a brain drain, and a lot of our really qualified, good people leave for opportunities elsewhere. You came in the other direction. So even though maybe it wasn't your intention in the very beginning when you came to Hawaii to open a practice, you did.
Yeah. And
then you, since while, expanded it. And I think isn't that sort of a testament, number one, to your work, but number two, that there are a number of people here in Hawaii who, like me and like others, are either conscious of something of their legs or their veins or worried about health. So there's a lot of folks out there that need your help.
Oh, absolutely, yeah. Vein disease in general is very underdiagnosed just across the country. But when you look at demographic numbers and all that sort of stuff that I don't look at all the time, but if you look at the numbers statistically of patients that are being treated adequately, especially in Hawaii, it's way, way too low. It's about a quarter of what it is on many of the in many of the states on the mainland. So,
well, I'll tell you, I'm one of these guys that now notices things, and I've had a lot of work done on myself, which you and I are going to be talking about a lot. But mainly, I think a lot of guys say, "Yeah, it's part of aging," and I know that I'm just going to guess that our lady listeners are a little bit more conscious or worried about the appearance part of it. But I also know that there's things happening underneath your skin, in your circulatory system, particularly in the veins, that can be lifestyle threatening. And maybe maybe a lot of these things are being put up with by people that shouldn't put up with them.
Oh, absolutely. Yeah. The symptoms of vein problems or this thing we call venous insufficiency, the symptoms come on over such a long period of time in such a slow fashion that people get used to having those symptoms. They think they just have to live with it. And with respect to what you just said, we hear that all the time.
I bet.
Oh, I'm just getting old, or I thought I was just getting old. We treat a lot of people, and then after they get done with their therapy, they come back and they say, gee, doc, I didn't know how bad my legs felt because they feel
I'm
great
right
now.
there. I'm right there. I'm so pleased that we're leading off with that. The analogy that I brought to the table was this. Every now and again, let's say somebody over a period of time has, arthritis in maybe in their hip, and they start, after a while, they favor it and they start limping. And then somebody says, 3 years later, why are you limping? I'm not limping. Yes, you are.
Right.
Have you seen a video of yourself? Man, you limp.
Yeah.
Same thing with this, right?
Oh, it's amazing.
Yeah,
It's amazing what people can get used to and just decide to live with. And I think especially with vein problems, is that they don't know that the remedies are out there.
Yeah, and boy, we're going to change that. We're going to let a lot of you folks know, not only out there, but a plan of attack and getting treatment is a lot easier than you thought. So when you meet a doctor and you see he's got some stuff hanging on the end of his name outside of MD, Dr. Juleff is actually FACS, which means
Fellow of the American College of Surgeons.
I love surgery because I know that many practitioners, surgery is the last resort. You don't just walk into a patient and say, we need to do surgery on you. But having somebody to have the training. So I would imagine that there's any numbers of surgeon fields, which I know there are. We're talking about your vein surgery, vascular surgery. We're talking about orthopedic surgery and everything else. Okay, let's zero in on what interested you as a young doctor in vascular, in veins, in the circulatory system.
Well, when you go through medical school, the first why that you come to, the first fork in the road that you have to deal with is, are you going to be a medical type doctor and treat diabetes, high blood pressure, prescribe medication primarily, or are you going to be a surgeon? Are you going to want to treat things in a more mechanical fashion?
Yeah.
And I think that goes to the personality of the person.
Yeah, I would sort of tend to agree with that.
And it was funny. I can remember in medical school how you could kind of identify, even before you knew anybody made their decision. Oh yeah, those people are going into medicine, or those guys are going into surgery. But I always kind of knew that I was going to be a surgical kind of person. I like to do things. And, mechanically correct things.
Yeah, the thing that I find exciting about what you do is, I guess, augmented by the fact that there have been tremendous changes in the methodology or in the tools that you have to now do these things. From what I understand, and I want to learn about this like I'm sure everybody in the audience does, there's an awful lot of things going on scientifically with the treatment part of your practice than was even available a decade or two ago. You couldn't do things like what you do today.
Oh, absolutely. Yeah. When I was in my training, when I was initially in my training for general surgery, certainly even after when I was doing vascular surgical training, the devices and the methods that we have for vein treatment now weren't even being thought of.
Yeah. That's fascinating to me.
Yeah, and that's one of the big deterrents, I think, to people actually coming in and seeking treatment for vein problems, because they know what grandma had 30 years ago,
which was an unpleasant experience in many cases.
It was not a happy time.
Yeah, really. This might hurt a little, they said. Yeah, well, they didn't tell you the rest. But I know from personal experience how true is that. It's just like when people walk into a radio station where they haven't maybe seen for 20 or 30 years. There's not one piece of gear in there except the microphones we're using that are even similar.
Exactly.
And so the training kit for Radio 101 now is not anything different. How do you stay up with it? Because I do know that patients who come to your offices all day, every day, they hear the latest. They want to know what's up. How do you keep pace with that stuff?
Well, there's professional journals, the magazines. We get them every month, and you try to read as much of that as you can. You can't read 24 hours a day, but reading those types of materials, going to meetings, going to medical meetings, and I try to go to 2 or 3 different vein specific kind of meetings throughout the course of the year. And just, hearing about new devices. I mean, the companies, especially in vein care now, it's very device-oriented. Yeah. And there's new things coming out all the time. And the companies that manufacture that kind of stuff, want you to know about it. So they give you calls. And, it's an ongoing process. I mean, I really encourage our staff also to do educational kind of things so that they can.
Yeah, and gang, let me tell you, when I went to Dr. Juleff's office, I felt wow, that's really new stuff. And I, because some of my treatment was a while ago, I know I got to get up to, let's go up to the 201. And there's all kinds of different treatment. And some of it is strictly cosmetic, and we'll talk about that. And some of it is more important. And when Dr. Juleff and I got together and decided to get this program started, it was just a few weeks ago that I saw some stuff in the news. It's much more regularly advertised on television commercials now, particularly people that have other ailments. And then they talk about this thing called DVT. Was that even discussed years ago?
Well, we knew about DVT. Yeah,
well,
definitely.
you guys did, but I don't know if the patients did.
No, people. It's so much more recognized, and the media has, especially taken on DVT in particular, which is a very, very good thing because it teaches people how to avoid it, and are they at risk for it? What can they do to minimize their risk of suffering a blood clot? It's good that the media has sort of taken an effort to make people more aware of those types of things.
Yeah, and I think here's the little jewel that I picked up, and that was a lot of people, in their golden years is when they've amassed enough money to do the things that are on their bucket list, and a lot of times that means travel. And from what I understand, if you've got some bad stuff going on in your veins and you're taking lots of intercontinental flights, and if you don't know a little bit about what you might expect, you might be in for a big surprise, a big health surprise, and it might happen in a foreign country somewhere.
Yeah. Or up in the sky.
What are some of the contributing factors to be susceptible for this DVT?
Well, one of the things that people don't know, and even even a lot of medical advice doesn't really touch on the idea that people with vein problems in general, this thing we call venous insufficiency, makes them, just by virtue of them having it, if they have varicose veins or abnormal function of the veins that are deeper in the leg, they're more susceptible to DVT, to blood clots.
Yeah, I get it.
So when we treat them, we can kind of bring their risk back down to the normal, general population. But other factors are age, immobility, dehydration. When we talk about people going on plane rides, the thing that the reason that happens is because you get on a plane, you're sitting in one place for 6, 8, 10 hours sometimes, especially if you're flying from Hawaii, and you might get a little dehydrated.
Sure.
Or maybe you're drinking fluids that aren't necessarily good for your hydration, like coffee and alcohol and those types of things. That all kind of adds to the risk of it happening. And that's when we see it happening, long plane rides, long car rides, people who are laid up in the hospital. I mean, that's a notorious place for DVT to happen.
Interestingly enough, and I know from personal experience and from a lot of anecdotal stuff that I've heard, the leading health institutions here in Hawaii are so aware of that they have little exercises that they tell you to do. You're going to be in bed. I was really impressed with a bed at a hospital that I saw that had a mind of its own. It just automatically moved people around every now and again so that they didn't stay laying in one space.
Right.
That was not around when I was in the hospital. That's kind of new stuff.
Yeah.
Okay, but I'm still interested, and I know our audience is. When you talk about veinclinicsofhawaii.com, you're going to see a lot of this stuff. A lot of work has gone into developing a user-friendly website. We're going to point you at it on a regular basis. We're going to let you know that you can click on that thing and find out all kinds of stuff. And obviously, Dr. Juleff, he is on several islands. As a matter of fact, let's go through that. We're here in Honolulu recording the program. Your first office is on the Big Island. That's been there about 8 years. What happened? Where did you expand to first from there?
The first office after the Big Island was actually Maui.
Mm-hmm.
And we opened that probably 5 or 6 years ago.
Okay.
And then right around the same time we opened here, and then also on Kauai. And it just, again, it seemed to evolve.
I like your Mileage Plus card. Because,
I've got
but isn't that also true that because of that, obviously there's a need? I mean, you open these places; they're still open. That means that you made a good business decision. But I'm also thinking that maybe some people don't realize that it's not certainly not all cosmetic. There's all kinds of things that you do that are cosmetic, right?
Sure.
And obviously maybe one of the answers to that might be because, look, we're outside. We're outside all the time in Hawaii, and, you see all of our stuff.
Oh, yeah. Yeah.
So at what point in time, though, does somebody take a look and say, well, okay, I want these little spider veins on my legs to go away, but I also think I have other problems. And so I'm thinking that maybe somebody that comes in for something strictly cosmetic learns while they're there is, hey, you know what? You better take a look at this. We don't need to do anything right this minute, but we better keep an eye on this. How does that work?
Yeah, every day of the week that happens.
Yeah.
Because unfortunately, again, most people think and have been told that not only spider veins, but even bigger problems like varicose veins or skin discoloration or chronic swelling, that it's not that big of a deal. It's just if you're not having major problems, don't worry about it. It'll be fine, but it won't be fine.
You mentioned in the very beginning that one of the issues about this particular field is that it tends to creep up very, very, very slowly over a long period of time. So maybe the alarm bells don't go off to a patient until they are a train wreck. And which is kind of the way I was going. And I'm really willing to share that. And we're going to, from time to time, Dr. Juleff is going to have some patients come in here with case studies where we can actually talk to some people about what they discovered. Let me ask you this. I love analogies. And I know a lot of dentists, and they don't do, orthodontistry, but they refer people to it. So I'm guessing that an orthodontist can pretty much always find something to do because there's no such thing, I think, as a perfect mouth. Is that similar in your field especially? If somebody is just curious about how they're doing, I need a shave and a tune-up, is that sometimes a good idea to do?
It wouldn't be a bad idea. I mean, because, again, the symptoms of venous insufficiency are so easy to overlook sometimes.
Yeah, that's what I'm worried about for people.
And if there's any thought in someone's mind as to whether they might have a problem with their circulation in general, whether it's arteries, veins, something that we call lymphatics, anything, they should look into it because it is so easy to find out. It's so easy to answer the question. Typically, for the vast majority of the patients that we see, we evaluate them with ultrasound.
Sure.
And I mean, that's a quick, easy, completely painless,
non-invasive,
and gives in anymore the technology behind ultrasound, visualization of whatever, but especially blood vessels. It's fantastic.
How helpful is that when you're able to show a patient in real time? Okay, this is your leg.
Oh yeah.
Press down here and woo, what's that over there? And maybe the reason I ask that is because I guess, and I'm just guessing, you originally are a West Coast kind of guy, right? You were in school at Oakland and some of the other things. And I'm guessing that because of our ethnicities here and our ages here, and we're a lot older people, that it must be just literally a candy store of being able to treat all kinds of different maladies to do with circulation.
Yeah, it's a cornucopia.
Yeah. And I can imagine it must be frustrating to some. It is for me. If I'm walking around and I see somebody with something that looks bad, I think, boy, I know what that is. I had that. Boy, why doesn't this guy get that fixed? It's going to hurt him on later.
Yeah. Well, I think about that all the time.
I bet,
And I have to hold myself back not to pass out cards.
Tap you on the shoulder. Excuse me. I've noticed it. No. But you see, that is I think, the main success that what little we know each other as we get to know this, that everything I've heard is so positive at the way you grew to respond to the need of the people that are in each of these places. Are pretty much the four offices pretty similar?
They're very similar. Kind of, well, yes and no. Similar in the same way that the different islands are similar, which each island has its own personality.
Yeah.
And it's not having grown up here, and then now spending a lot of time here. That's one of the things that has amazed me the most is how different each island can be. I mean, it really each one does have its own personality and feel, and vibe, and the people are a little different. I got to tell you that a lot of people come here and find out that there's all kinds of studies that are done here, whether they be tobacco or cancer, because of the multi-ethnicities. Are there certain groups that are have a propensity for venous disease than others, maybe diet related?
or genetically, or what, some of the things that you deal with?
Yeah, not necessarily diet. And that's one of the things with vein disease. There aren't a lot of things that we can do from either a dietary standpoint or a medication standpoint, or controlling diabetes, stopping smoking, that kind of stuff that will affect arterial disease. It doesn't really have the same impact on venous problems, and probably the biggest thing that the biggest risk factor for developing venous insufficiency is definitely genetics. Yeah. So
what's the bad news about Pacific Islanders versus, people from Taiwan or people from Nairobi? I mean, I would imagine that a lot of it is the ethnicity, the propensity of that particular person being at risk.
Well, especially the Polynesian cultures. And again, this is just from my observation, especially here. It's very common, and there are probably a number of cultures where it's a little more common than others, but in that it all has to do with genetics. Yeah.
Interestingly enough, and this is the other thing, I do know that, and by the way, I do this whenever we have the opportunity to talk with the doc, and I'm going to tell you all too. Nothing can be diagnosed here on the radio, so I mean, you're not going to get any take this and do that 3 times from Dr. Juleff or me, because a lot of these things do require that you get a look at. I'm going to imagine that since you chose the specialty of vascular surgery, there's an awful lot of MDs that refer patients to go to a specialist like yourself.
Oh yeah, sure, yeah, definitely, yeah.
And so when that happens, I know that there's a line that has to be drawn, and I know this from personal experience. A lot of what you do, I think, is can be looked at as elective surgery. I want to make my legs look better. Are there times that particular thing, those little spider veins, which we're going to talk about, I hope, are they a threat, or are they strictly something that is maybe unpleasant to look at and you don't want them?
With respect to spider veins specifically, they rarely have a major medical or physical impact.
You see, that's what I was going to ask you. If you have a spider vein, do you have other problems?
Well, you might.
Yeah.
You don't know, and that's why I say people who aren't sure, they just need to come in the office so we can easily answer that question with ultrasound. And getting back to what you said before, we see that all the time where people might come in with just spider veins, they may say, "Hey, doc, all I want are a few little injections to these spider veins and
make them go away."
Yeah. But
But by the way, I had one that went away that I had for like 30 years. It was about as big as a silver dollar. And it went, pfft, and I'm thinking, whoa, this is pretty magic. It's going to come back. It hasn't come back. Not on wood yet. Yeah.
That's good. Yeah. That's good. Often they do.
Yeah, that's what I was going to ask you also. From what I understand, you have millions of these things. And if you go get rid of a bunch of them, some people said, well, I got them treated, but they came right back. Can the same ones even come back?
The same ones can, or it's hard to know. Did the exact same ones come back, or are there new ones in that same area? Yeah. I tell everybody that comes in for spider vein treatment, and these are purely cosmetic patients, not those with an underlying medical problem. But we don't really cure people of spider veins. We manage spider veins.
Yeah, that's what I was going to say.
Now, we can do a pretty good job at that, but people have to be, kind of persistent in their therapy.
Yeah, well, you mentioned something earlier, and I know that there's a lot of people that have a fear of anything. Many of you know, and Dr. Juleff's going to know, that we do a program on a regular basis with Dr. Russ Masunaga, a dentist. And there are people that have dentophobia to get into that chair. And I'm guessing that a lot of people whose grandma was laid up and wrapped up in bandages for a month when she had her spider veins removed, that you're a walk-in, walk-out with most of these things now.
Yeah.
That's amazing, isn't it?
Yeah. No, that part of it is definitely. But with respect to that, there are a very, very small number of people. Nobody likes getting a shot. Mm-hmm. In the way that we treat spider veins, specifically.
It's a shot.
Yeah,
I've been there, done that.
And sometimes if somebody has a lot of spider veins, they get a lot of shots. Yeah.
But that's another thing. From what I understand, because of the non-invasiveness now, or less invasive, that you can do more work at one time. I know that there are people. I grew up. A lot of people know in the retail business, and particularly in Waikiki and on the neighbor islands. And the majority of the employees that worked at our family business were female, and most of them were on their legs, on their feet, 6-8 hours a day. And this was long before the warning signs. So somebody comes into your office right now, and they've got some issues, more than spider veins. Can you teach them new tricks as to how to, how do you take a rest during the day? What do you do to sort of manage this thing rather than need surgery all the time?
Well, I think when somebody like that comes into the office, and yeah, you're right. I mean, people who, as a part of their profession, are on their feet, many hours of every day, they're definitely at risk for developing venous insufficiency. The important thing there is to diagnose them fully.
Yeah.
To fix whatever they have that's broken at that moment. Now, that doesn't mean, since it is a genetic and it's partially related to some of these other risk factors, that doesn't mean that we're not changing their genome.
Yeah.
The genes
it's still there. Yeah.
And so they're always going to have some propensity to develop venous problems again.
How many people? Oh, go ahead. Now.
So, but yeah, you're right. They do have to make some lifestyle changes, and unfortunately, one of those is the thing that nobody likes, and that's compression stockings.
Yeah.
But
I listen. The minute he used to that thing came up to me in my life before, I said, "Oh no!" And I remember when there were these things that wrapped around your legs. They were just miserable things. And there's a couple of companies you can tell us about. I think one of them that I've learned a little bit about is in Germany. And these guys they shouldn't even be called stockings.
Yeah.
Because they're really a medical device, aren't they?
Yeah. They can get pretty extravagant.
Yeah.
But on the other hand, there are enough manufacturers of compression stockings these days now, and they're getting better, such that they're making compression that, even though it's substantial in the amount of compression power that they have, they're still they can be very comfortable, and they can look stylish and all these sort of things.
Yeah, sometimes I even seen this one guy that works here has some neon colored ones.
Yeah.
And and he runs with them. But see, that's the other thing. Some people, and I know that I was like that. I did this a while ago, and it just became a pain. And then I didn't do it every day. And then I realized you got to go back to doing this. Isn't that exactly one of the things that you say to somebody? Look, this will help you, and here's why. It's counter to my mind. I don't understand how putting pressure on my leg helps it. What does it do? Why is that compression on the bottom of my leg that I'm wearing right now? What is it doing?
Well, it's compressing your leg, but it's also compressing the veins within your leg, and that benefits the function. Part of the anatomic problem of venous insufficiency itself, and you probably know this, there are a bunch of little valves, one-way valves in veins that keep the blood moving in the direction that it should.
In a perfect world, right?
When everything's working right.
Yeah.
But those valves can fail. Now, part of the reason why those valves fail is because the vein itself is beginning to dilate. So, for one reason, compression stockings will allow for that, continuous compression to keep the structure of the vein a little more intact. We call in addition to that, there's also the stockings are constructed in a way they're called graduated compression. So there's more compression lower in the leg.
So around the ankle or just above that?
Ankle and feet.
Yeah.
And then it kind of diminishes as you come up. So the natural progression is to kind of, push the fluid upward as the muscles are, as you're walking and the muscles are contracting.
I'm guessing, and this is only because I'm a little bit more observant than I used to be. I notice these things. And it's pleasant to see, particularly traveling. And I want to go back to that because a lot of our listeners are at that age where I don't want to say they're bucket listers, but they are. And they want to go visit. As you know, like we said, a lot of people move. They're on the mainland. They're going to go visit grandkids back east. You're talking about this guy that gets on an airplane, and he's going to be on that airplane for probably 12 hours.
Yeah.
And so there's risk there.
Well, there's risk, and that's often when people start to have their first major noticeable symptoms. They're the achiness and the heaviness and all that sort of stuff they can ignore for many, many years because it's coming on very slowly. But then they hop on a plane, and they get to where they're going, 10 or 12 hours later, and their feet are the size of footballs, and they finally go, whoa, something's wrong here.
Well, let me tell you what prompted me. I was on my way to the mainland to do a television thing, and I took my shoes off and I went to sleep, and I couldn't put my shoes back on, and it would be pleasant to have my shoes, but I needed to put my shoes back on, and they just wouldn't go back on.
Yeah.
So the guy at the airport, one of the hosts there that was there for us, he said, just elevate your legs a few minutes, you'll be okay. We can get them back on you, and that happened. That was really proof positive that stuff works. Mm-hmm. And so rule number 1 to Mike Buck was don't take off your shoes on an airplane unless you're wearing compression socks.
Yeah. Right.
Okay, I want to get into something else. If you're just joining us, Dr. Randall Juleff is Vein Clinics of Hawaii. We're going to learn more about his people and his staff and his associates. But by and large, this is his dream come true is to have these 4 clinics operating and serving the people of Hawaii. There is a move underfoot in the homeless community, Doc, that I'm sure you've seen some stuff. There was a DVD done recently called Prescribing Hope, and it was getting that. And there's people that are going out and treating leg ulcers. And I do know that there are different things in leg ulcers, but from what I understand, some of them are attributable to vein issues. And I wonder how dangerous this is.
Mm-hmm. Well, there's substantial danger with respect to that, specific issue. When you look at ulcers of all different sorts, I mean, some ulcers are because of diabetes.
Sure.
Some are because there's poor arterial flow, or PAD, as they say.
Yeah.
There are a few other reasons why people might have ulcers, but the biggest reason why people might have chronic ulceration of the lower part of the leg is venous insufficiency, venous stasis, ulceration. It's a huge problem. It is a huge problem because people, even with that, often people don't seek, proper evaluation and potential treatment. And they can go for years.
I was going to say, isn't it sometimes amazing that whatever circuitous route a patient it was like the circuitous route that brought you to Hawaii, that sometimes they just don't understand, they don't realize that they've been putting a bandage or tape on this thing for years.
Yeah.
And that's not normal, is it? There should be a way to heal up.
Right.
And one of the things I want to admit and explain and Doc can explain sort of what happened to me. The perfect storm for me was this horrific injury I had to my lower leg. I got a big piece of angle iron went into my leg, massive big emergency room and everything else. It wasn't healing, and like it was supposed to, doing all the things it was supposed to do. And then the doctor said, what you've got here is this wound from outside, and you've got a vein on the inside, and the vein's no good, and now you have this thing called an ulcer. And first of all, I was embarrassed because I thought I had something to do with it. But luckily, it took months of good management to get rid of it. Isn't that sometimes the decision, or sometimes the only way to help somebody is to really be aggressive in treating the thing? Oh, yeah.
Aggressive, persistent.
Yeah.
And it takes a certain amount of responsibility on the part of the patient.
It scared me to death, to be honest. Now that I know what it is, I feel better. But it's scary.
And a poor vein function. The thing that it ultimately leads to. I mean, initially, when it first starts to become a medical problem, the first thing that it leads to is symptoms and varicose veins that people don't like, and they can be symptomatic also. But eventually, after many years of that abnormal blood flow that we see in venous insufficiency and the increased in pressure in the skin from the valves not working, blood going the wrong direction, it ultimately leads to damage of the skin. Now you're talking what I know a little bit about. And folks, this is one of the things that we're steering to. And I promise you, one of our shows down the road will be devoted strictly to this condition. And that's because there's so much of it. I know that if you just take a look around today, now that you've been listening to the show for a little while, you can tell when people are walking around in the store or on the beach, at the bottom of their feet, it's like dark skin. And it looks kind of leathery, because I guess it is. It is, yeah. It's from,
and this is because of venous insufficiency.
Yeah, venous insufficiency.
Wow.
And, ongoing and chronic increased pressure, in those veins, again, because the blood's settling down because of gravity. Now in you, and we see this in a lot of patients where they'll have that condition. They won't really recognize it, but the skin is getting worse and worse with time. But the thing that happens is they have some injury. You had a pretty substantial,
pretty
one.
big one.
But I mean, some people can hit their leg on the coffee table, and the skin, it breaks. And it looks like just something that should heal relatively quickly, but it doesn't. It goes on, and then it gets bigger and bigger, and it becomes a major problem. Yeah.
And we're going to delineate that, and sometimes how incredibly long it takes to manage it or to heal it, and I guess and hopefully prevent it from coming back as strong as it was there the first time. And I think maybe that's part of sort of the big picture, why that we have to maybe make people aware of this slowly, because once again, going back to, people, let's say that they go online and they got a hole in their leg, and it may be not from the outside. This is what we're talking about, isn't it? Most of these things happen inside. It's not because you banged into something, although that might open it.
Right, right. Yeah.
Are there people, and here's another thing. I promise that we're going to spend a whole program on that pretty soon.
Yeah, we would have to.
Yeah, but what about the difference? Now I know about veins and arteries. I mean, we have this system going on, right? Maybe is it just two, or are there more? I know of two. Are there more than two systems of circulation?
Well, the main two are arteries and veins. Yeah. The other system, which is really actually very important, especially as it relates to vein disease, are what we call the lymphatics.
Lymphatics. That's the word I was looking for.
And lymphatics are, again, you'll learn about in high school. You'll learn about arteries and veins.
Yeah.
Arteries bring blood from the heart to the body. Veins carry it back. But you don't very often learn about lymphatics. And lymphatics are very, very important with just moving fluid from one part of the body to the other, and basically from the extremities back to the blood system.
Yep.
And they don't carry blood as much as just clearish, probably body fluid. And the lymphatics actually carry a tremendous amount of fluid over the course of a day from an extremity.
Yeah, to me, it's incredibly interesting, and the thing that fascinates me the most, and hopefully, I don't even know if you guys in your business know this, but there's something magic that happens, usually in the feet, because all of this blood that is in your arteries coming out from your heart and rushing to all your arteries all go down. Something happens to send them back up. I don't get that part.
Yeah.
I mean, is there a gap? I mean, it's like, okay, is there a baton that's being passed? What is the bottom of this system? How does it work?
Well, that's a good question.
yeah. I get paid medium bucks to ask the big questions.
Thank you for asking that.
You bet.
Well, I think everybody knows why blood flows through arteries, and that's because the heart is pumping.
Sure. Big old pump.
And unless you've really ever thought about it, I think most people think, well, the blood's going to come back up through the veins because the heart's pumping. But that's, as you know, not the case.
Not the case, yeah.
And so there are several things that happen within veins that make the blood flow. And we've talked about the valves.
Yeah.
The valves are very, very important. And when the valves are functioning properly, they're one-way valves. It's a check valve. So
Can you see them?
Oh yeah, you can see them, but they're small.
Yeah,
they're just tiny. When you do look at these things, especially in what we refer to as the superficial venous system, they're just tiny little wisps of tissue.
Yeah.
But when they're working, they work great. When they fail, not so much. But so the valves are very, very important in keeping the blood moving in an upward fashion. Muscle movement. Just muscle contraction within the leg is also very, very important. There's a mechanism that we refer to as the calf muscle pump. And, in the vein world, the calf muscle pump is sort of the equivalent of the heart.
Yeah, but it's at the other end, right? I love this. Your calf's at the bottom.
Right.
So as long as you do that, and I'm so used to it because I work sitting down like many of us do, but I get up a lot during the time that I do that.
Yes.
And I've been I think that's whether you do on your tiptoes or whether you're sitting in your chair pulling your big toes up towards. This is a pump.
Yeah, and it's good getting back to the prevention of DVT, especially if you're on a plane or a long car ride. That's what you need to do. You need to do something that's going to allow for your calf muscles to contract periodically to keep that blood moving.
Remember when we were younger, it was the flight attendant would say, "Feel free to move about the cabin." Yeah, they don't say that much anymore because I don't think they want you to move around the cabin.
They don't.
Yeah, but so not being able to move around the cabin. To get up to go to the restroom or whatever. I see more and more people, I'm one of them, that I'm sitting there and I'm trying not to hit the seat in front of me because I don't want to get the guy mad. Yeah. But I think that moving is pleasant.
It makes not only is it good for your circulation, not only is it protecting you from something like DVT, but it makes your legs feel better.
Yeah. Yeah. What takes place physically? And this is coming out of the blue. Dr. Juleff has no idea of the questions that I'm asking. I just come up with this. I'm so curious. When people stand up and say, my foot's asleep or my leg's asleep, what is that? I mean, is it a circulatory issue? Is it a nerve and muscle issue? What causes people to maybe even sometimes fall down because their leg's not working the way it's supposed to because they've been sitting in one place for hours?
Yeah, well, that's more of a nerve issue.
Okay.
Most of the time. I mean, if you sleep on your arm the wrong way, or if you're crossing your legs for a long time. Usually it's not a vascular issue. I mean, if there's a vascular compromise of the arteries, for instance, will that make your foot go to sleep? Numb? Yeah, it will, but that's a major problem.
Yeah.
So typically those situations where, your foot goes numb for a little while and then comes back is usually a nerve kind of thing.
Okay, I'm hoping that some of you that are out there are realizing when we talked to Dr. Juleff earlier, we were talking about the old and the new. And just being in a modern clinic today and seeing all of the services that are available is mind altering. And also the amount of work that can be done with the tools of the trade. Like, for instance, you have these little wires that I know that can go up inside a vein for like feet. That must be just when you osmose from what you were doing before that to that must be, you must walk out of the office saying, holy smokes, I can't believe that works.
Yeah. Well, which is one of the reasons why I made the transition from working primarily as a surgeon in a hospital to what I do now, primarily in the office, is because the capabilities of us to treat, especially vein issues, but a lot of different things, and do it in the office and under local anesthesia. I mean, we certainly don't put people to sleep anymore. It's been a real journey, and it's amazing. I mean, it still amazes me every day of the week, the kind of things that we can do with the patient awake and in the office, and have a major impact on their vein leg health.
And I think, folks, that this gives you a clear opportunity to go to veinclinicsofhawaii.com and take a look at this because, obviously in a perfect world, we'd all just want to look better and feel better. But if you've been putting up with something for as long as some patients have, that we're going to be talking about a lot, I think the repair job is even a little bit more difficult because I guess the old thing that I used to hear from my grandma all the time was, well, if you nip it in the bud, it'll be better. Yeah. But you said that we have an issue with the whole thing of vein disease, right? Because it comes upon us usually so slowly, not overnight.
Yeah. People don't recognize it.
What's a young patient for venous issues?
How young can somebody have? Yeah. The youngest patient that we've treated is 15.
Wow.
Yeah, but that was somebody who had a very, very strong family history. But we treat people from 15 to their mid 90s.
Yeah, and I know that I'm going to be in the mid 90s group one of these years down the road. But I can tell you that there are a lot of people that get sedentary, and that from what I understand, they are many conversations away from compression stockings. They don't do the right kind of exercise. And I guess we don't want to link one thing to another. That's why I want to make sure that people don't think, well, I'm a diabetic, so I've got a vein issue. But if you're a diabetic, you could have a vein issue.
Oh, definitely. Yeah. Absolutely. And you might be having symptoms of vein problems that you're just attributing to your diabetes. For instance, you talked about the discoloration of the lower part of the leg, the brownish discoloration, and the thickening and stuff, which you see all the time. But I can't tell you how many people come into the office and say, "Oh, well, yeah, that I have that brownish discoloration, but it's just due to my diabetes," and not so.
Yeah, I got to tell you, but however, I think it's the first thought that almost everybody has.
Oh yeah,
and one of the things that I've noticed, and bite my lip, I don't say anything because I know it's just not proper a lot of times, but I see a lot of people with very large legs, and usually they go from leg to foot. There's no ankle; it's just all one big thing. And I'm like that, and I'm wondering if sometimes that what we do is we created a problem. Maybe somebody was, say, morbidly obese, and they got really big swollen legs as a result of the weight. They lose the weight, but their legs are still big. It's so that means it probably what we're talking about in the discoloration. Is it reversible? Can that heal and come back, or is that pretty rare?
Rare. Yeah. At least as it applies to venous, the discoloration that we see for venous insufficiency, unfortunately, and everybody asks us this question, gee, after you fix my vein problems, is that brownish discoloration going to go away? It might lighten up a little bit, but unfortunately, no, it does not go away. Yeah,
and so that wouldn't be something, and I'm not, at least in my age, I'm not going to be vain enough. I'm not going to look for body pancake or any of this stuff. I do know that there are some things, but I think that further to that, and what we're going to probably do the next time we get together is begin at the appearance part first. And I know that, for instance, if you squeeze your arm and you see a lot of these things, that these things are veins, but are they? How bad is it if you get a cut and one of those gets cut and you don't deal with it? You don't just put a Band-Aid on it, do you? How do you know that you've damaged the vein by cutting it?
Well,
I only say that because I'm looking at mine and I can see them for a change. I didn't used to be able to see them.
Well, you're pointing to veins on your arms.
Yeah,
and you just, with respect to the upper extremity, there's not the functional implication of vein.
Oh yeah, I'm glad you brought that up because the bottom part. Yeah, that needs the pumping and it needs the valves.
Right.
The upper part's gravity, right?
Yeah, there's so much more hydrostatic, pressure, since we spend most of our life in an upright position.
Yeah, sure.
There's so much more hydrostatic, pressure from the top going down, having to do with the leg veins, and we just don't see that in the arm. So, if you, for instance, some people with bad venous disease and dilated veins superficially, sometimes they do rupture. They can the skin can erode over the top of a little vein. It doesn't take much of a size of a vein. It can be very small. And that erodes, or they, typically it happens in the shower, actually, or they hit themselves, and they can lose a tremendous amount of blood.
Yeah, I was going to ask you about that. I've heard about that before. I actually saw somebody that was panicky, and what they did was they started bleeding in the shower.
Yeah.
And they went flying out of there and going as fast as they can to go to the ER. And when they got to the ER, they said, well, did you elevate it? No. Well, you probably should elevate it.
Yeah.
This is gravity at work, isn't it?
Sure. Yeah. And if you typically, it's such an easily solvable problem when somebody has sudden bleeding like that, but it can really freak people out.
Sure.
Because again, it usually happens in the shower. The blood is kind of mixing with all the water that there is at the bottom of the shower, and it looks like they're bleeding to death. Now, sometimes they can lose a lot of blood, but yeah, it's as simple as laying down, elevating your leg, and putting a little bit of pressure on that site, or having somebody help you do that. But it will stop. It's not a.
I was going to say, well, when it stops, is it because it's clotted up and the vein is going to heal?
Well, yes and no. Typically, when a vein bleeds and then it stops, and then people will come into the office. Typically, we need to do something a little more to assure that site is not going to rebleed, because it could.
Yeah. One thing I've always been interested in, and this one lady I remember years and years ago said, she had spider veins and spider veins and spider veins removed, and the first question she came up with is, am I in danger? I mean, don't I need these things? I mean, we keep taking these things out. What's the deal? What are spider veins? What's their purpose if they have one?
No, spider veins they don't really have a purpose as such, except for the fact that they're normal veins in our skin. Spider veins are in the level of the skin. That's why we can see them so easily. But basically, they're just very, very superficial veins that have become dilated for one reason or another. Now, either it's because they can be related to an underlying vein problem, venous insufficiency. It may be just one part of the whole problem, or some people don't. Some people just have genetically, they've developed spider veins, and they don't have an underlying problem with vein function. So in that case, we treat the spider veins. And, but do they have a major functional value? No.
Okay, now there's some spider veins that are these little tiny red things that are, especially if you have lighter colored skin.
Yeah.
But there's some that, from what I understand, it looks like a spider web on top of the surface, and they look very, very long. Are they connected with anything when you remove them? Do you get new ones?
Well, spider veins we don't remove.
A treat.
Spider veins we inject.
Okay.
And basically...
I'm glad you brought that up.
Yeah.
The removal part, we're going to talk about that in the next program, when things have to be surgically removed or eliminated from the system.
Right. And typically those are the bigger veins.
Yeah.
Those are what we call varicose veins.
Yeah.
Those are the bulgy, ropey veins that everybody knows about. But those veins, typically we remove. And that they're also of minimal functional value at that point because they're so abnormal. But spider veins, are they connected? Yeah, they're connected. Do they take on, various different types of patterns? Yeah, they do. But
I know a lot of baseball players, for instance, that get hit, by a bat or a ball, and then they have like a rupture or a bruise, and it stays there.
Right.
So that must be. Well, say goodbye to that thing. It's not functioning anymore.
I hear that a lot. A lot of people will say, "Oh yeah, I've got all these spider veins over here because, I got hit when I was young, or I used to play volleyball, soccer, and I always got." Sometimes trauma might play a role, but there's plenty of people out there who have spider veins that have never played soccer or have not had an injury.
I liken that to the story where the doctor says, well, you got tennis elbow. Yeah. And the guy argues for a year, I don't play tennis. Exactly. How can I call tennis elbow? Okay, and then one more before we conclude the first edition of the program. When we come back, I promise, next time we are going to talk about spider veins because that's a whole big thing. And it's what causes them, what can you do about them, when do they become a social problem? I mean, are you better off without them and all of these things? But I want to also know, we also talked about your FACS, but what is a phlebologist?
Phlebology is really just the study of veins. Yeah, study of veins and their
just
function.
Another way. See, this is why I'm the question asker, not the doctor. Yeah. But I think it truly is fascinating. And once again, the Vein Clinics of Hawaii got its start about 8 years ago on the Big Island, and now you're on 4 islands. And I guess the best thing to find out, Dr. Juleff, is just to go to that website and take a look around, do some surfing.
Yeah. Well, our website is relatively new, and I enjoy going to it myself. There's a lot of good information. There's a bunch of videos. So you can watch
I'm looking at it right now, gang, and I want some of you to do that. And then when you come back next time, and by the way, tell everybody about the program. It's going to settle into this slot. Played on Saturday and Sunday, and we've got a whole bunch of things coming up in the future shows. And I want to thank Dr. Juleff, number one, for being able to spend the time that it's going to take to do this thing, and number two, sort of let you know that there's going to be plenty of room for you. We're going to devise a way that you can ask a question of the doctor that will be done when we record the show, and we will get to you by email and say, the question that you sent will be answered on Saturday, the next Saturday, or whenever it is. It's going to be totally interactive, and I guess when you said that, your website's kind of new, it may be kind of new, but somebody's working on it pretty hot, because I've just added to my favorite places, and it's pretty good.
Well, thank you. I appreciate it.
We look very much forward to seeing you next time, Dr. Juleff. Thanks for being here. We'll catch you next time.
You're welcome.
You've been listening to the Vein Clinics of Hawaii show. If you like what you hear, drop us a line. If you don't like what you hear, come back next time. We'll do a little bit better for you. Thanks for listening. Aloha.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.